Aortic valve basically is a valve which is a gatekeeper basically in between the biggest vessel of the body and a heart chamber. Now it basically functions for the chamber to eject the blood out into the biggest artery, and the entire body gets the blood. So this is a very, very important valve. And when this gets narrowed significantly due to calcium deposits, or sometimes or malfunctioning of the valve, in the sense that normally there are 3 curtains of the valve. Many a times you have only 2 curtains there. So this predisposes to the narrowing of the valve rather. So when the valve gets narrowed, this terminology is called aortic valve stenosis. TAVR or TAVI, the full form is trans-aortic valvular replacement or trans-aortic valvular implantation or valvular implantation. Basically, both the terminologies are similar. It basically means replacing the aortic valve by a valve from outside without performing any surgery or cutting the chest open. It's a minimalistic procedure which lasts for around maximum 45 minutes to 1 hour. Sometimes it prolongs itself, but very rarely. Basically, a couple of years ago, maybe before 2002, if there was aortic stenosis or narrowing of the aortic valve, one used to replace the valve by cutting the sternum open or by an open surgical route, and for that the patient had to undergo general anesthesia and stay in the hospital for around 7 to 8 days. TAVR is different because the valve is replaced percutaneously without opening the chest up in maybe maximum 1 to 1.5 hours time. As the procedure is evolving, the time is shortened remarkably. The patients can be discharged the same evening if everything goes well, or maybe the next day. Such is the simplicity of this procedure. TAVR or TAVI is a very specialized procedure. So when a patient is looking for a trained structural heart disease cardiologist who are specially trained to perform TAVR and the other devices implantation. As the science of structural heart disease therapeutics evolved, TAVR can be used for very low risk patients also now, So that is the simplicity, again, as I repeat, of this procedure. It has evolved remarkably, and now it can be performed in intermediate and low risk patients also, not necessarily very high risks. The valve basically, the TAVR valve which is implanted is basically a tissue valve. It's either a bovine or a porcine tissue valve, which is a natural valve, so it adapts to the body remarkably well. TAVR basically and ideally should be performed in individuals who are usually 60 or 65 or more years of age. So the valve will last for a good 15 to 17 years. There are not much precautions to be taken when you have a TAVR valve or when you've had this TAVR procedure done, except for a single antiplatelet drug which can be taken. And of course, if you have smaller surgeries or non-cardiac surgeries performed, one should go to their cardiologist and he'll take further directions for giving instructions. So by and large, a very simple, sort of a directional procedure. The success ratio of TAVR or TAVI is 95 to 97%. I mean, it's almost evolved beautifully, the whole procedure. Minor complications, the complications which are there are extremely uncommon. You may have a very small chance of a stroke. You may have a reasonably small chance of having a permanent pacemaker, and a very small chance of vascular complications, because it's done from the groin, so you may have a small chance of having that. By and large, a very safe and a very simple procedure. Once the TAVR procedure is done, if everything goes well, many of the centers all over the world discharge the patient the same evening if it's done in the morning. Many of the centers again discharge the patient the next day. Only remarkably few patients who develop some form of rhythm disturbance or smaller complication rates are kept in the hospital maybe for 2 or 3 days more. But by and large, most of the patients are discharged by the next day. Aortic valve stenosis, the prevalence in India should be around 3 to 5% of the general population. Now, when you develop aortic valve stenosis, the patients complain of breathlessness, they tire very easily. Many of them would have giddiness or dizziness. Many of them have chest pain. One should consult a cardiologist who then runs an ECG and a 2D echocardiography, and the diagnosis of aortic valve stenosis is made in combination of symptoms, ECG and 2D echo. As the awareness of aortic stenosis has increased, and as the awareness of TAVR and TAVI has increased, lots of patients have been treated at the Hinduja hospital at our center. All the cardiologists at this center are very nicely trained, and the entire procedure is done successfully and effortlessly.